Yeah, thank you. We have an employee of the month. She's not here this morning, but her name is Yolanda Harvey. And Yolanda worked in our dietary department, and she was nominated by someone outside of the department. And it states, Yolanda always greets patients with a smile on her face. She's personable with each patient. She spreads with joy and always goes the extra mile to make sure they are happy and have what they need. The next time she's here, we'll bring her up, but today she's off today. So.
Bring her in sometime.
Yeah,
Okay.
so, yeah, dietary.
Thank
So
you.
we want to thank her for that. Also, just please note on your agenda, Randall Waltman, he will not be here this morning. He had an emergency this morning, EMS report, and then Craig Gibson had to go over to the clinic in Fairville. They're doing some work over there for patient care. So
Okay, I understand. We're not staffed where people can just go in and do stuff. They have to do it themselves. The next item is medical staff report. Dr. Conrad.
There we go. Good morning, all. I don't have anything new today. Everybody has been working really hard. If you talk to any of the staff, both the nursing staff, ER and floor, and the EMS, there have been some pretty high acuity cases, fairly high volume, and some extra crazy stuff in the days during and following the buck moon, the full moon of July. That's a real thing, what you hear about full moons. If you see any of the staff, give them an attaboy and attagirl, because everybody's really been working hard, but nothing new. Any questions, help yourself.
We've had some really bad accidents in the county.
Yeah, yeah.
I know y'all have been busy. 1, 2, 3. All right, the next item is clinical service report. Courtney Alford.
Good morning. I don't have a whole lot either. We have been busier. Thankful for that. Dan's been doing good work. He has been traveling a little to meet with case management. He even went to Lake Butler this week. They have a very robust swing bed program. So hoping to continue to build on that. He's been doing a good job there. We do have another BLS, ACLS, and PALS class coming for the staff this month in August. So other than that, we have a PRN nurse that's taking another job, but she's PRN with us. Still looking for some more nurses, but everything's going well.
and also at the end of the meeting, we have the executive session, and so we'll do the risk management report then. So we'll have
Yeah,
more.
we have to do that. Exactly.
That's all I have unless you have questions.
Your nursing is staffed pretty good right now, or I mean, I didn't.
We need
quite
more night shift nurses for sure. I mean, we could use a few more nurses for sure, because we have to kind of manage the census based on the staffing, and that changes, week to week, schedule to schedule. So, yeah, we're pretty good for about the next week and a half. Then we're going to have some. It's summer. People are taking off. I've got a nurse out for a week this week. We definitely need some more night shift nurses. That would help us to be able to admit more patients and stuff as well, like Dr. Conrad says.
Any other board members got any questions? Okay, thank you, Courtney. Next item would be Craig, and he's not here. He's busy working. The next item is the CFO report. Mr. Bowling. Did I miss something?
I got Susan.
Okay, come on, clinic. Good.
Good morning, everybody. So this report for this month is just to let you know we have a continued increase in new patients. All the providers are doing a great job with that. It's steady. Amanda Page, our new nurse practitioner that's part-time, she saw 22. Suzette continued at West with 18 because we're still seeing that flow over from Dr. Sonala's group. And Dana saw 29. Now this includes new patients steady for consultation and to remain our patient, as well as new patients also considered tourists.
Close to the mic, or turn it up one. I can't quite hear you.
On the back.
I thought maybe it was my hearing. Probably is a little bit of my hearing.
Speaking of that.
I do? Okay. I'm soft-spoken, sorry. Okay, so
There you go.
There we go. We are the ladies, the nurse practitioners and the staff have all been handling all the new patients and the tourists really very well. Same with the nurses in the hospital and working together. And we're preparing for the flu season, so we've ordered our flu shots to prepare for September is when we usually get them in. And we have 2 of our providers out on vacation, a well-deserved vacation because they've been working very hard. But we do have Amanda Page covering both facilities at this time. Unfortunately, not unfortunately, but we had one of the other providers that was going to cover the East Clinic went out on medical leave and then retired out from there. So Amanda's doing a great job for just the 2 weeks, and then Suzette should be back. She went back home, so it'll be a little while that she's out. But we have great coverage, and we have very qualified LPNs that are there to triage patients in their absence. So, and we have the ER.
Yeah, and so right now, in both the clinics, kind of like one of limited services, because we got one provider going back and forth there. And so, you know, Dana will be back in a couple of weeks, and we'll be back up in staff. So we had that provider that had a medical leave, and, you know, that kind of there.
Yep.
And also, Susie,
And,
go of course.
I was going to say, and we're looking forward to the new phone system that's going to come in, so that'll help greatly. And then we are working with our EMR system, our electronic health system, to do a little bit smoother changes with fast self-check-in with patients, loading up forms so people can do it at their homes, and then the phone system will help with that as well. So, any questions for the clinics? Or
I'm
No?
glad that phone system's gonna get in. What's their timeline on that phone system?
Well, they're waiting on
Consolidated, right?
Consolidated right now, so it should be any time they can get started. But
Yeah.
Consolidated don't have one person in this region that works.
Yeah, we're in the rural area that everything takes a little bit slower. We're on island time.
Who is Consolidated?
That's Fairpoint, you know, the phone company.
Yeah.
Consolidated phone company. They run the phone company for Franklin County in this area.
We're a hospital. Somebody needs to remind them of that.
Hmm.
I don't care how many people they got. I really don't. David, you call them and bump them a little bit.
Yeah.
We're a hospital,
Yeah.
and we should be a priority issue right there. They can bring somebody from Duke Energy takes them all over the state. I'm just tired of waiting on this, and we're waiting on whoever Consolidated is, which I don't have a clue who they are. Do we contract with them?
Yeah, that's the
believe
phone.
so.
Yeah,
That's who
yeah, that's
IT
the
is
phone.
working with.
Yeah, that's the phone company for Franklin County. It used to be called Fairpoint back in the day. I don't know if y'all had phone services. You know,
Right.
a lot of us don't have phone services. We got cell phones now. But Consolidated bought Fairpoint, and so Consolidated kind of like covers like the landline phone system for this region up in the north area region there. But I'll make another call. You know, we'll get on and see when we can. Hopefully by the next
That's a poor
meeting.
excuse.
Yeah.
That's
Yeah.
a poor excuse.
Yeah, because we've been
right
waiting
there.
on it for a while.
You know, I mean, I don't care if we ain't got 10 people here. We got a hospital. You know? David, get one of your sermons there. One of you. You know,
Yeah. Well, we'll jump on it. We'll jump on that. Also,
yeah, I really think we need to. I think and call them every other day.
Yeah.
Aggravate them.
Yeah.
You know, whatever.
well, we definitely would do that. And then I think Dolores Room had a comment.
We've ordered them. We've pre-ordered
Already?
them so that we're ready when the season hits. But we haven't even received them yet. But they'll come in September, just so that everybody's aware. Yes, we'll have them available as soon as they come in.
Yeah, that's how.
Well, that's a personal preference, but yes,
Yes.
it's recommended.
I have on my report. I have 2 items on my report, Duffy. If you want me to wait to the end, but it's concerning the physician recruitment things. What we've been doing. The clinic plays a role in that. Susan's here.
Well, you can go ahead.
Okay. All right. So the physician recruitment, you know, we're utilizing a platform called 3RNet for physicians for rural areas. So we've had 42 inquiries come from that platform to us since April 2024. We have met with 2 physicians who have inquired that was serious about, I guess, taking the next step. One had to wait until next year because of family issue, and the other physician is graduating in, was it June
2026.
2026. So we get this platform. We get a lot of physicians that send us inquiries, and then we have to see if they interested. Sometimes they do like a scatter shot kind of deal. So we're still calling the list down of all those 42 to see if there is any serious intent, you know, to work
Yeah,
with
most
this.
of them are students or people
Yeah.
that have to go. They're already a physician wherever they're from, but they're coming to us because of rural health and they want to serve the community, but they have time out that they have to serve their residency somewhere.
Some of them do, yeah.
Yeah.
Okay.
So we'll see.
Yeah, and then also, on the interlocal agreements discussion, just to let you all know, I had separate meetings with both Mayor Millender and the City of Carabel and Mayor Ash, the City of Apalachicola, to discuss their interlocal agreements. The Board of County Commission would like to utilize dollars from the Healthcare Trust Fund to pay for EMS services instead of using ad valorem taxes. Both cities will have to agree to amending their agreements to use the surtax dollars for EMS. So right now, $764,000 come out of the Healthcare Trust Fund, not healthcare, I mean the ad valorem taxes. And so the county commission want to use the other side, the capital outlay portion, to pay for EMS services, but both cities have to agree. The city of Carabel, with their interlocal agreement, they indicated that, we will do urgent care services, extended hours, and extended weekday hours. So I met with them about that. Prior to COVID, we were doing some weekend hours at that time, and we were short-staffed. So
Yeah.
now that we're fully staffed, we will begin to look at that, implementing the weekend hours again, and the extended weekday hours. We'll figure that out. So that's just something that, so you all know what's going on with that. And I told the Mayor Millender about that. The City of Apalachicola, basically, they're more concerned about, building some kind of new facility or renovating this facility because that was in their agreement for them. So I just want to let y'all know that. Done.
You give us the dates of the interlocutory agreement and the date of the...
Yeah, the interlocal agreement was 2007.
The actual date.
17 years
Okay,
ago.
the actual date, the city, let me get the date right here. The city of Carabel signed this agreement. Well, it says it was adopted October 9th, 2007, but the timeline is on here that was stamped and received was November 13th, 2007.
Okay, October 9th. Can you tell us when the public voted on the referendum and were there differences in language between what the public voted on and what's in the interlocutory agreement?
Yes. Okay. The public voted November 6th. And here's what the public voted on. It says, shall a 1-cent sales surtax be imposed in Franklin County for the sole purpose of improving the quality and delivery of health care by constructing a health care facility in Carabel first, upgrading the ambulance services, and paying the cost of operations of healthcare infrastructure and services, including construction and paying debt service on bonds to construct a new public hospital facility to replace Weems Memorial Hospital. Now that was the ballot. So the public voted on that. Either you vote for or against that. So that's what we voted on in 2007. But in order to get the counties, the different cities, to use their surtax dollars, they had to come up with an interlocal agreement, and that's where that language came in. And the Carabel interlocal agreement language.
Well, basically, it was the interlocutory agreement was signed prior to the citizens of Franklin County voting on it. Why was, I know you don't know that answer, and I don't know it either. But basically, I think there's going to be a legal issue on that because the public was not basically told what the actual funds were going for.
Yeah. When I was, of course, it was 2007. I voted
Yeah.
for it. But anyway, I can't.
I'm just saying there is a discrepancy in there that you've got an interlocutory agreement that's prior to what the citizens voted on. And then in that situation, what takes precedence? I know what they want because I listened to their county commission meeting or their city commission meeting, and I understand that. But again, it's an interlocutory agreement. It's much broader than what you put to the citizens of Franklin County.
All right, so I just wanted to bring that out so everybody would know what's going on with that. And, you know, David Bowl and I, this afternoon, we will be doing at the county budget workshop this morning. And so they may, this afternoon, I mean, they may mention about the 764 that they're trying to pull out of from Evalorum out of the healthcare sales site.
Can I ask another question, please, Mr. Chairman? Did we lose the doctor?
Did we lose a doctor in Weems?
Yes.
No, Dr. Newton was the doctor that was using our building. He was with PMH Memorial Physicians Partners. So he left on his own accord for his choice.
Recently?
No.
We lost
just,
Dr. Sanala and Claire Spence in the area, so we took on a lot of their patients.
No, but we did lose a physician assistant.
Yes.
Me-
Roy Parker left.
Yeah, that was recent.
Yeah.
That's the one that left for medical reasons.
And he was based out of the East Clinic, so.
So what, out of the East Clinic? So what happened with that workload? Who has to pick that
Yeah,
up?
Well, that's why we hired Amanda Page. We hired her as a PRN to do both clinics, and she was there mostly when I first introduced it to her, was to cover the ladies so they could have a vacation. And at that time, Skip was there, and he was going to, Skip is his nickname, was there to cover the East, but some things come up as it does in life, and so we only have 2 weeks where we have limited coverage.
Thank you. I mean, when people ask you these questions, I don't know about it, so I have to learn.
Sure. And he was a great care, but he was also very limited in his schedule, too. He was only there 1 day a week, so Amanda's done a great job trying to pick up the load over at East. So we're growing, and we're going to meet those needs as we can.
Yeah, we have about when I looked at the East Clinic, you know, it's about a 25% increase in volume here. And as we go through some of, really both clinics, as we go through some of the data, when David Bowling talks about that, you'll see how the level of increased services really across most of all of our service lines there. But the clinics really have jumped up.
Let me ask a question. Do the patients that we got, Dr.
Sanala.
Sanala, do they seem to be happy with
Oh, they've I can speak for the Appalachia Clinic because that's where I'm mostly at.
Right, yeah.
But they come to me personally and say, I can't believe how thorough Suzette is, and your staff's very kind and caring. They take a lot of time with us. So that's great feedback for me.
Good. Word of mouth.
Yeah.
Good.
Yeah. And if there's any, I truly, honestly haven't had many complaints at all from them because we've gotten them in a timely fashion. The only thing that they're adjusting to, and not in a negative way, is the plan of care might be different than what another provider did for them, you know, as far as how often they're seen or what they're seen for, because you had, Sanala was really a cardiologist, and that's when he used Claire Spence to do the primary care. So
But
there's
I-
a difference in that kind of care.
Yeah, and I had, you know, people stop me all the time and just thanking us to be, so that we were able to take them on. I had a gentleman that was traveling, getting ready to travel all the way to Tallahassee for primary care. I'm like, no, you don't have to do that. You know, you come here. And so he came and he told somebody else, you know, we were at a meeting with, so it's a service that we're providing in the community. An elderly lady came to me when we first started, and she just said, I just want to thank you because I'm too old to be driving. You know, I'd rather come right close to the facilities here.
Our next line of service will be a bus service.
I know Dr. Lon had been in business here a long time, had a lot of
Yeah.
loyal patients, and we're very comfortable. I'm glad to hear that.
Yeah,
Very glad.
Suzette's done it. I mean, and they are, because he was a cardiologist, they're very complicated history. And so we're doing a great service to them, but also, you know, everybody forgets we're in a rural area where there's no specialty services here. So we'll be looking into that too. It'll be, if we get a physician through the ones that we're interviewing, hopefully they'll have a specialty service that we can bring on. Any other questions? There we go.
I think I asked this question last year. I ask it again probably next year.
Sure.
Can you read the, as far as veterans records, I went to the VA last week. Can you all get in and see those records? We're not there yet.
No, they are on a totally different, very secure system.
Oh, there.
They will never allow anybody to get into their records. You have your own portal that you can get onto with the VA.
Yeah.
But when we first started working with them, they, you know, because I asked if we could have a interface with them,
Yeah,
and they
that was
said
just
no,
one.
it is a completely secure system because it's, you know, Department of Defense system. So.
Okay. I made her a copy of my records that I'm going to give to Suzette, you know, so
Okay.
she'll know what's going on.
Yeah,
You know,
yeah.
so-
I mean, we'd like to have that service, but we have to respect too, You
Yeah.
know, and that's a good thing, that, as you see with all the hacks that have been happening, to have
Exactly.
that extra layer of protection, so,
Okay,
okay?
thank you.
Anything else? No? Thank you.
Thank you. Get that phone system. Let's aggravate them and, yeah, we will. And, I know if my phone was out of the house, my wife would be calling them every other day. They get tired of hearing from her.
But we have the phones are up. We just
I
want to
know,
update.
but we need this fast. I mean, they've been stressing out for years, and it will, with the increased volume, it'll increase your effectiveness and everything. Okay. All right. CFO report, Mr. David Bowling will be here from the line. Is the board familiar with Mr. Bowling? Everybody familiar with him? Okay.
Chairman. Good morning, everyone. And, similar to what I presented last month as well to the board, I want to share the results of the June 2024 month in and tie some of that activity into what the year-to-date performance is for the 9-month period of 9/30/2024. And then, as David mentioned earlier, talk about some key statistics and financial indicators and so forth. Is that better on volume? Talk about some key indicators and some financial metrics and so forth for the hospital. When you look at, and before I even get started too, I know there is and something we have been working on throughout a line as well is on presenting the financial information. There was a formatting change, David, I think that was distributed to the board this month as well. And it's a more, I guess what I would say, condensed income statement, profit loss look, a more condensed balance sheet look, but it focuses on those key areas and not necessarily into a lot of the specifics. We can always dive into specifics and share more, but thought it would be more concise on the way that material was presented to the board. When you look at June 2024 activity, the net income for the hospital did finish the month at a negative $69,000. That is as compared to a $193,000 loss this same period in the prior year. For the 9 months ended fiscal year to date for the facility, though, net income did finish at a positive $429,000. So that is up from where we were this time in the previous period. When you dive into June 2024 specifically and look at key drivers for the month of June of 2024, the gross patient revenue for the hospital did finish at $1.3 million, or roughly over $1.3 million, which was up $241,000 or 21% versus this same period in the prior year. David kind of touched on this.
But on this consolidated form, we're really not able to really see where that gross patient revenue is being generated from, correct? I mean, we used to be able to look at it and say outpatient, inpatient. We're not able to really see what's driving the gross revenue here.
Absolutely, and that report's available. That same format, and that can be distributed. That can be distributed to the board as well.
So why did Alliance decide to change the format?
Mr. Berry, it's just more to really look at a more consolidated, concise formatting. If you look at, and the details are available. That other is, we can certainly circulate that back out and send that actually during this meeting. We want to look at the actual details.
David, you're not dumbing this down for us, are you?
No, I'm just consolidating it. Just consolidating material.
That's what I'm concerned about.
Oh, yeah, just consolidating material. Now, absolutely, David can circulate that same format. There's no hesitation to do that. It was more for the visual representation of it. You can certainly have those detailed financials. You can have as detailed as you actually want. So that's certainly, I think he just stepped away to go ahead and circulate that or print those back out for the board.
I mean, you could
Mr.
have something like this in here, but the details should be here too.
Back up from it. Oh, back up from it. Oh, come into it. There you go. Okay.
Dive in.
I got you. Okay. Yeah. Sorry, Chris.
I was just saying, you could have a summary like this on here, but
Sure.
I think the detail
But the
needs to
detail
be
behind
there
it.
as well. If you want to
Absolutely.
go through the
That's fine.
summary, that's fine, but I'd like to flip back and look at what's going on.
Absolutely. That's no problem at all. I think David just went to go circulate that out to the board as well, so that's no problem. When you look at gross patient revenue, though, Bill, to dive into those specific areas, I mean, gross patient revenue, again, finished at $1.3 million, which is up $241,000 or 21% versus the same period in the prior year. Those patient revenues were up across all patient care areas. So that was all service lines with the exception of EMS. That was the only area that we saw where revenues weren't up versus the same period in the prior year. Inpatient revenues, I want to highlight that when I said 241,000 was the increase in performance year over year. When you look at inpatient revenues, those were up 221,000 of the 241, with total patient days up 25 or 139%, which swing bed program did represent 21 days of this 25-day increase. So significant improvement in performance from the swing bed program. Outpatient revenues, those were up as well, approximately 30,000 versus the same period in the prior year, with outpatient visits up 59 versus the prior year. The mammography service that was brought on board, did contribute to 20 of those visits of that increase that I just referenced. Also recorded within the outpatient revenue is the ER activity. And I know Dr. Conrad mentioned this earlier as well, but the ER has continued a solid trend month over month. I mean, the ER is still tracking well over 400 visits on a monthly average basis, which is about 14 to 15 visits on a daily basis when you look at it from that aspect. Actually, June was actually a little bit stronger than at that actual trend. I think June had about 465, so about 15 and a half or so visits on a daily basis, which again, that's encouraging to see that increase.
I'm going to ask a question. I don't know if you can answer or not, but roughly, our rural health care clinic visits increased by 49% from the previous month. Right? Yeah. I'm looking at what does that translate into going in our pocket?
That's a great.
Any, I mean, depending on insurance companies and stuff like that, but that's a lot of money, right? I mean,
You're exactly right. I mean, it is going to depend on the insurance, depend on what type of service, what level of service. I mean, that is strong to see that. I will say a lot of the clinic activity, though, that we have seen, and you'll see this within some of the key projects that were implemented here. The chronic care management program that's in place, that has helped a lot as well drive that additional business for both clinics.
Oh, that's figured. Okay, that's
figured.
So that's a
Absolutely.
clinic visit. Okay.
Yeah, it's figured in with the clinic activity that's happening.
Well, next question. From what I've heard, we should continue along this trend, maybe not increasing, but at least keeping where we're at. You think so?
I think so, yeah.
I know, our job's kind of looking to the future a little bit, so.
Right. No, we're looking at other lines of services that we could implement that type of.
We got, my wife says I don't hear very well, okay?
We can get you a hearing test. We're also looking actively at different lines of services that we can bring into that type of a clinic. It's not like a private doctor's office. You do have certain rules and regulations of the type of services that you bring there, right? Because of the way that the claims go out and of the reimbursement from the different insurances companies. So there's that. But yeah, we with all the new patients and then ebb and flows also with the tourism, right? So yeah, we get our batches of tourists, but because everybody, and the trend is also people are going to marketplace for insurances, and a lot of them aren't aware of, I'm sorry to be over you, a lot of them aren't aware of their policies. So a lot of their policies from out-of-state places limit them to see another primary care. They can't just go to a primary care office to be seen, and that's the difference between an urgent care versus a boutique clinic or a retail clinic or different names for it, okay?
I understand.
So then those people are directed to the ER because that's the only way they can either pay out of pocket or they can go to the ER, which will be covered by their out-of-state insurance.
Okay. Thank you very much. That was in line. Thank you. Go ahead.
Absolutely. And so when you look at other additional outpatient-related activities that the hospital has seen those increases. The infusion services that's been implemented, that program, as well as additional tests that have been ordered, and I know as Susie just mentioned as well, the activity from the clinic, that does drive additional tests, obviously within the organization, different labs and so forth that are needed. So that did help contribute some from that increased activity within the outpatient. The clinics, as the chairman just referenced, did finish June, up approximately 49,000 when you look at it versus that same period in the prior year. So to put dollars around that, it's around 49,000 more than what we did in the same month in the previous year. That did reflect an increase of 203 visits when you look at it year-over-year comparison. And again, as I referenced, that chronic care management program did contribute and has seen around 115, which was recorded this month of June alone. Kind of moving down now to talk about, okay, so that's gross. That's what we charge for the patient care that's being delivered here at the hospital. When you look at net patient revenue, and that's what we anticipate collecting on these services, net patient revenue did finish up approximately $223,000 or 43% versus this same period in the prior year. That is driven in part and mostly from that anticipated cash or anticipated, I guess I should say, receivable recorded for the swing bed activity. Again, I referenced swing bed program was up significantly during the month of June, which again is extremely encouraging to see from a fiscal year-to-date standpoint, the 9-month year-to-date standpoint. The swing bed program is outpacing where we did in the previous year, but this stronger performance in days for the month of June is reflected as a receivable. Obviously, we haven't collected that cash on those services that were provided in the month yet. Moving on down the sheet, when you look at the hospitals.
Those receivables, I guess it's what we call it, a net receivable. If you put it on the books and it's in that number, how many of those accounts do you find out following month or 2 months that you have to write off or you have to remove because of the fact they're not going to be reimbursed, or where do I find that number?
Right.
I mean, I don't want to, you know what I'm saying?
I do.
Otherwise, it's
Understand.
going to look inflated.
Sure.
You
Sure.
say I got a loss of $49,000 for the month, but within that receivable, there's some possible
Right.
things that shouldn't be in there, which would reduce that to 49,000 when that number may have been 50,000.
No, that's great. That's a great question. And what the methodology that the hospital utilizes to estimate, again, it's an estimate of what is anticipated to receive, and that estimate is based on historical performance. So when you look at the historical 12-month look back of activity that has been charged, billed, collected for the organization, you use that same rolling methodology to estimate what we're doing today. Does that clarify that? So I'm looking back, you look back at the previous 12-month period of activity and use a methodology to estimate that based on the previous rolling 12-month activity, this is what we anticipate we would collect based on today's services.
David, I guess we see that on the balance sheet here. Patient
Contractual
receivables,
allowances.
less allowances, your allowance is 7.49%. And that's what you're rolling.
That's your allowance.
That's your
Absolutely. That's the allowance. You got your gross receivables,
But
you got your allowances.
that allowance number, though, was a guesstimate, right?
It's historical estimate. That's correct. That is correct. It's a historical estimate. And that is an industry methodology that's recognized across all hospital. And again, within that, you're basing that on the historical performance, historical information. Massaged into that number, obviously, is those contractual relationships that you have with those various payers, as well as your governmental contractual relationships and so forth. So
And that's where I'm headed. That's where I'm headed with who actually stays on top of what that relationship and knows when we are getting shorted.
Sure.
Or in fact, we've been overpaid and we're going to have to pay more.
Yeah. want to chime in. That is part of the team's process that works here. I mean, you utilize TrueBridge from a billing standpoint. They are responsible for the day-to-day activity as far as billing and collecting on the cash. When you got governmental-based business, obviously when you file the cost reports and so forth on an annual basis, that determines your go-forward rate on your governmental-based activities, your managed or your Medicare Advantage products that we have seen, obviously within a lot of hospital environments. Those contracts are individual-based contracts. However, those contracts will pay that prevailing Medicare published rate. So staying on top of that, I guess, Mr. Berry, is obviously you got the billing team that is being utilized through TrueBridge to help bill the claims for the organization, but on a contractual standpoint, that is maintained internally through the team and evaluating those contracts when they come up for renewal.
That billing team, that's not our person.
Yeah, okay, we
got a lot of other duties to do too.
Sure.
But I'm wondering, is that something Alliant provides?
Yeah. Well, TrueBridge is a billing team that we utilize as well as our staff here. So every week, Heather's on calls. I mean, then we meet with them on a weekly basis, bi-weekly now. That we look at everything that's come in, then we go back and they do a look back on what the insurance company should have paid us, and then we say, okay, they didn't pay us this amount, then we go to those insurance companies. And so that's, we're doing a better job now than we ever done. When I first got here, it was $1.6 million that was not being collected, because we thought this other company that we partnered with, of course I wasn't here yet, that was collecting the money, and then we realized they were not. But since Alliant has come on board, we kind of like revamped the whole revenue cycle piece, of our department here. And Heather and her team has been doing a great job. And the TrueBridge team is a very, very good team because we look at those dollars and we see what we should have been paid, and we go back, on a consistent basis, which we didn't have that before because we didn't have enough staff here.
And David, that's why
TrueBridge is a system.
it is.
Yeah, it's a system that it's a system that we utilize billing.
And the TrueBridge system.
People, part of
There
that
are
people.
People that are on our staff, they're not on Alliance.
No, they're not on Alliance staff.
Right.
TrueBridge is a company that
It's an outside vendor.
it's an outside vendor that's
Yeah, Mr.
part of our
Mayor.
electronic health records that help us with billing, and our team works on that. And then Alliant, for example, Tom was always a part of that. Now David Bonner is Jason Bonner is a part of that. David Bowling would be a part of those meetings too, but Jason Bonner, he's the other Alliant personnel that is on those calls with us as well, because he's more the financial person.
And Mr. Berry, and that's why I reference team. I mean, it's a team effort. I mean, there are various folks. I mean, TrueBridge is a Mobile, Alabama-based company that is your EHR system, but it also is the hospital's revenue cycle billing support team. You get the team here internally, you get the team through Alliance. So it is a collective effort of everyone that's focused on those activities for the organization. And as David referenced, I mean, and again, it's in the financial indicators. I mean, we can dive into that, take a look at that. But when you look at patient cash collections, which is, again, the receivables, the net patient receivables that the hospital anticipates receiving for those services after it's factored down or allowed for based on historical performance, based on contractual relationships. When you look at the patient cash collections, patient cash collections was at that's true dollars. That's going to pay the bills. That's going to pay the bill. That's going to pay the employees. That's going to help us continue to move forward. When you look at that activity, it was $14.7 thousand on a day basis in the prior year. That is up to $22,500 in the current period. So you can see that, and you can see that it's on, I don't know which schedule in your board packet where that's at, but there's a financial indicator section that references that year-to-date performance, 9-month fiscal year-to-date performance, and identifies and shows that actual cash improvement. So within a significant lift in cash from the hospital. That's fantastic. And a lot of that's driven from services that have been increased, but also a more dedicated focus on getting that money in the door.
How often do they reconcile the difference between what we're projecting historically and what's actually happening?
Well, it's on a rolling basis. So team Team internally looks at that obviously on a month-to-month basis, right, when they're recording that actual allowance. However, you do have your fiscal year-end audit, right? And the audit process, I will say the audit process, Carr, Riggs and Ingram is your auditor for Weems. They do the historical look back as well to co-validate what the hospital has recorded. A lot of times they may see that the hospital may have been too conservative or not conservative enough, right? So they may, and they're able, I guess the best part about that is they're able to do it after your fiscal year ends. So they, obviously they got several more months ahead. So when they actually go back and refresh and do that same look back, more activity has come in, so the number gets tighter. But monthly basis, rolling basis, and then of course co-validated within the audit process.
David, I got a question here. One of the presenters to the county commissioners criticized our receivables. I don't know what they are, 80 days now, whatever it is, And I would, you can take care of that by just write it off as uncollectible. You can bring that down in a day, can't you? Yeah, you could, but we don't do that, correct?
No, sir. No, sir.
And another thing I'd like to emphasize with regard to collections, I guess we could contract with some headhunter type company to get them collectibles, but we don't do that. And I don't think we need to do that just to make the books look better. I mean, the type that call you up at 3 o'clock in the morning and stuff like that. So, collection folks, I don't think that medical needs to get into stuff like that. That's just, we got our own people working on it. We got other people working on it. I think, my opinion is we're just at the right happy medium right there.
Yeah. We always want to improve. I'll
Do
say
what
that.
now?
We always want to improve.
I know that.
So that's a challenge. That's what we want to do.
Improve at the expense of what,
Right. And when you look at, and again, I know, like you just referenced, there's a lot of information that gets shared. But when you look at specifically inside the details of that information, and it kind of gets back to Mr. Berry's point of what's truly collectible, what's not, and how well are you estimating your net receivables. But when you got a combination of what is commercial-based insurance or governmental-based insurance and/or the uninsured, non-insured, really the no-pay type situation, that's in your number, right? So when you have services, good or bad, right? When you see ER activity grow, that's good, right? It's encouraging to see that we're able to care for the patients. However, a lot of that ER traffic that happens in most situations in a hospital environment is uninsured too. So that becomes very hard to collect dollars, quite frankly. And to your point, the team holds on to those dollars for as long as we can with efforts to collect those monies. And then when it's determined that it's just truly uncollectible, that's when that write-off activity happens, and you just remove that from the books.
And why I ask this question is because I want to know what Alliant is doing for their $8,000 or $9,000 a month for a controller, okay, as opposed to what the accounting staff has to do, what percentage of time they're spending on this certain area, as opposed to having to let other side things slide. And that's where I'm coming from.
Good question. That's great. No, that's fantastic. We hope to answer your question with that. It is providing that accounting oversight, accounting support, accounting review.
Yeah, but I've still got to go deeper. I've got to try to understand what percentage of time Alliant is spending on it, as opposed to how much time is our accounting crew spending.
Yep.
And are they taking more time than it should be? And they should.
Sure.
Therefore, that's what's inflating the need for another person or another two people in that accounting department.
And I think there too, to help us some context around that too. When you have timely financial statements, you have accuracy within your financial statements. You have, and your year-end audit really tells that story. If you got an audit that has 40 plus pages of audit adjustments, and/or do you see that improving? Do you see that guidance, that oversight, that support, those procedures that's being put in place to help separation of duties to help improve those activities? You got to have that in place, and we're seeing that improvement, and we're seeing that happen here at Weems, which again is extremely encouraging. And the team here, I know Sam and the team here are doing a very solid job. Which again, that's great as well, because we want that. We want individuals trained and grow internally to strengthen the organization. That way, you can have that true, that you can rely on those individuals for that actual support. Absolutely. Just a few other comments. As I move down the income statement and talk about the profit and loss of the hospital, as I mentioned earlier about the net income, when you look at the total hospital operating expenses, those were up $177,000 or 19% versus the same period in the prior year. Now, again, I referenced those expenses are up. However, the revenue for the same period of June was up 21%. So our revenue did outpace our expense growth. Again, from a margin standpoint, that is better to see. Within that operating expense activity, though, what I do want to point out is that personnel costs, which obviously, and I mentioned this last month to the board, personnel cost is your largest driver. It's typically of any organization, not just healthcare. That's your largest driver of your expenditures. Personnel includes your salary, wages, and employee benefits. Those were combined up $140,000 of that 177, which is mostly attributable, and I will mention this and keep referencing this back to that swing bed activity the hospital did see, and has Courtney referenced the needs for always additional nursing, especially if we have that expansion in our patient care areas. When you look at the patient day volume that was up within the organization, that is attributable to a driver to push up more expenditures, particularly in your personnel area and your nursing area to care for those patients. So you're looking at it from a percentage standpoint. If revenue's up 21%, expenditures are up 19%. From a margin standpoint, I'm in a better direction. Purchase contract services, those were up approximately $39,000 year over year, or the same month year over year. And a lot of that is due to that increase, again, referencing back to that patient care area. We do outsource or do utilize, I shouldn't say outsource, but we do contract for therapy coverage within the organization. So when you see that increase in your swing bed activity, you do have to provide the modality of therapy visits. So you do see those therapy costs increase, and that is on a contract basis, and that's attributable to a lot of the increase that we saw here during the month of June, as well as there are fees associated with that chronic care management program that's in place. But as I referenced there earlier as well, that's 115 visits or 115 visits for that chronic care services that we did not have at this time in the prior year. So again, good to see the growth, but obviously you're going to have some expenditures to go along with that growth. Lastly, on the income statement, the change in the year-over-year non-operating does continue to reflect the recording of the $191,000 in sales tax revenues, the improvement, from the non-operating revenues, but also, as you can see, the 340B program did outpace where we were this time last year. And just for a reference standpoint, the 340B program, when you look at it versus where we're at from a run rate standpoint, or I guess I should say the fiscal year-to-date standpoint, how June finished versus that average, we're up about $30,000 from where we were on a run basis. So that's, again, encouraging to see. Some brief comments I want to make on a balance sheet and from a cash flow perspective for the organization. The overall cash position for Weems Hospital does continue to remain steady. We have experienced, and you can see this, we have experienced some increase in patient AR. It did finishing June at 80 plus days, but again, as I mentioned earlier too, that swing bed activity, when you look at that actual increase in days, and I believe, David, this is in their board packet, the net receivables did finish the month at $1.5 million. That is versus $1.4 million in the prior month, so nearly $100,000+ more than what we had in the prior month. That does get reflected in your days, right? It's the product of the math on how the days computation is prepared. But that increase in 13 days from month over month is mostly attributable to those 28 swing bed days that the hospital has not been paid for yet. So that turn hasn't taken place to reflect and bring that number down. But based on historical performance, based on historical methodology, we anticipate that it will. Okay. And
I have a question.
yes, sir.
On the bottom, consolidated, you gotta explain this to me, with all the stuff in it. Consolidated net income, parentheses, all that. The variance year to date is a negative 438.67. That means what? I mean, explain that whole
No, I got you.
bottom line
No,
to me,
please.
will you?
Absolutely. That means your loss has in from a year-to-date standpoint, the facility's at a positive $429,000 in net income.
Okay, that's what I need to know there. I mean,
Yeah.
that little.
Absolutely. And when you look at June alone, now June did finish at a loss for the month. The loss was less than the loss was
Right.
in the same period in the previous year.
If we go,
But from a
For the
year-to-date
year.
standpoint, yes, we are at a positive $429,000 from a net income. You know, you factor revenues less your expenditures all the way down. You're sitting in a bottom line of about $429,000 positive for the year, 9-month year-to-date performance. Lastly, on the balance sheet, just to mention, to bring to the board, the hospital does continue what I would say a very, very manageable process with our accounts payables. Do a fantastic job of ensuring, as cash is coming in, good steady cash coming into the door, but also a good management process as far as cash going out the door. So timeliness of that is, I think, very important. And you reference that when you look at the overall AP balance, very healthy balance. Obviously, no vendors at risk within the organization. Vendor relationships at risk, I should say, as far as delayed payments or outstanding payments due to any particular vendors. Capital-related spend obviously continues to be held very flat or very minimal, obviously for the hospital, and there's no new long-term debt financing, no new financing arrangements that were entered into during the month of June for the hospital.
did I miss it? How much cash on hand? I might have missed it somewhere.
Yeah, cash on hand is it is on your metrics here. Cash on hand sitting at just shy of 52 days.
How much?
Just shy of 52 days cash on hand.
Okay, that's coming up a little bit. We're gonna have we're
Basically
gonna,
been the same for three
Yeah.
months now?
That's,
Same area?
yeah, last month 49, previous in April 44. I'm rounding up. March 44, Feb 51. So you're maintaining. That's what I mean by referencing cash is remaining steady for the hospital. You can see that trend. I think this is in your board packet, you can see that trend of days cash on hand since the beginning of the fiscal year.
we've increased the salaries of the staff here, so that's gonna take more cash to do that too. I
Pulls
think.
down the cash.
We'll have to understand that. And when are we coming up on a 3 payday month again? We'll take a hit then. We
Yeah,
always do.
November. I think November.
Okay.
That means we get paid 3 times a month, so that'll take.
Three times in a month.
That'll hit the cash.
It's gonna
cash
look
flow.
a little different right there. We lose cash on hand.
So you get paid bi-weekly?
Yes.
26.1?
Yes.
Yeah.
26.1 pay period?
Yes.
Okay. I want to go back to something that the chairman asked. Consolidated net income, I guess he referenced to the page there where it says negative 69,000. Okay. That, how do I say this? That is big, I'm gonna talk loud. Basically, that has a lot to do with the fluctuation of the sales tax that's collected, does it not?
Well, your sales tax is reflected at 191,000.
As opposed to
Yes.
133 the year before.
Correct.
So, tourism spending money affects that, but that's not really truly hospital operations. That's outside insurance. So it can hide issues.
Well, and I think a couple lines up on that income statement, you'll see net operating income loss. So there was a net operating loss, but that net operating loss is absolutely improved from what it was at the same period in the prior year. That's correct. That is correct. And that's what I was referencing earlier, Mr. Berry, when I said that your gross patient revenue or your revenues are up at a faster pace than what your expenditures are up, which again contributes to an improvement in the margin, although still operating at a loss. However, I think, as you just pointed out, I think it's very important to know that additional monies that do come into this organization absolutely continue to help, with the health care that's being delivered here at Weems. Absolutely.
Yeah.
And when you see,
Some of the driving forces are, as far as we keep getting more and more money, we keep spending more money.
we keep, when you see sales tax revenues coming in from tourism or other traffic that's being generated here in Apalachicola, I mean, we see, obviously, there's tourism, you see increased ER activity or things that may need to happen when patients are here, or patients are here, people are in the community, they need services. So it kind of goes along with it. But I will reference, as you just pointed out, I mean, it's a great point. I mean, it shows the importance of the community support, to continue to help, right, with activities at the hospital, keep help moving it forward. And that's extremely
Well,
important.
just to dovetail what Mr. Barry's saying here, I was looking at it, my question was going to be, when we look at the year-to-date numbers for operating profit, and we look at negative 202 million, 2.3 million versus the negative 1.8 the prior year, operationally, we are not doing as well as we did the prior year.
And Bill, looking at the line item details too, obviously in your personnel area, which is your highest driving area, that
Well,
is
I
a
recognize,
contributor.
salaries and wages and everything else, but the
Revenue
operating
base.
profit, when you look
Yeah.
at year to date, right?
Yeah.
June
Yeah.
last year versus June this year, we're 2.3 million in the hole versus 1.8
Right.
million in the hole, right?
Challenge is that rural facilities do experience, and this, you're highlighting a great point. And I don't mean to digress here or dive into a lot of different specifics. But when you look at your revenue from a year-to-date standpoint, it is up 1.7 million on a gross basis. That's what we're charging patients nearly across all service lines. We are seeing a decline with our EMS revenues, but every other revenue area is up across all service lines. Net operating revenue, which is what we expect to receive, is up over $800,000 on a year-to-date basis.
As we make more money and we bring in more patients, we have to spend more money to service those patients. Where's the break even?
And you're, and you're getting to, and this is the point I'm trying to get. You're absolutely, absolutely. And that's why I didn't mean to digress on this, but when you look at healthcare in general, where has been our increase here in revenues? You can clearly, revenues are driven, and if you look at the line item above and the detail on that, a lot of your revenue growth has been experienced in an outpatient setting. Okay, we've had to increase staffing and/or obviously referenced earlier too with some wage increases, which you do obviously put back into your employee, put back into your workforce. But when you have increased volumes in lesser reimbursed type areas, you still need the workforce to care for that particular service that's being provided. So from a margin standpoint, service profitability standpoint, there are some services that are more profitable and some services that are not. Right. However, in total, it compresses that margin, and we're seeing it in that number, which again calls for that additional support the hospital is receiving, from the community, and additional monies to help to
Yeah.
help with that gap
I get
that
that.
we experience from the services being provided, the gap in funding for those services that's being provided versus the cost that takes to care for those patients.
Do you see any of your rural hospitals that you're working on now in your Alliant group? You see any of them making an operating profit?
I will say this, that I don't know the exact percent number. I have seen hospitals that are, and we do have hospitals that are. Again, it geographically varies, Bill, in that situation. I do see, the state of Florida, for example, and I'll just reference that. Hospitals are doing what I would say better within a line perspective versus our hospitals in the neighboring state just north of us in Alabama. I'll just say that specifically. I just came from Alabama last night. It's a very challenged situation there with the gap in funding that those hospitals receive versus the care that's got to be delivered and what you had to put back into your workforce. I'll give you this good example. Keep staying up here forever, but when you look at increases in your workforce, increases that we had to experience post-pandemic, and we're seeing 30% increase, and I'm saying from start to finish, or pre-pandemic, post-pandemic, you see 30% increases in care that's being, your workforce, and that's the wages that you've had to increase and/or increase, quite frankly, in additional staffing, right, to care for patients. You see that increase. I can say promise you, but I can tell you that in a lot of situations, a lot of rural facilities, that increase in payment hasn't kept up with that same percentage increase in that cost of care. And that's a true challenge. I just mentioned this earlier, 52 rural hospitals, and again, I don't want to keep mentioning Alabama, but just came from there. 52 hospitals, 52 rural hospitals in the state of Alabama, 23 are at immediate risk of closing. That's as of April 24, so it's a few months still. But
Christy, she can hear you. She can hear you, David. Get that again.
oh, I'm sorry. I was referencing, the question was, are we seeing a lot of hospitals in a similar situation where they have operating margin losses? And when you look at, and I referenced the state of Alabama, for example, because it varies geographically, but Florida, I would say, is in a better performance than what we've seen in other states. And the question was, where does Alliant facilities rank? And what I was just mentioning about Alabama is there's 52 rural hospitals in Alabama. This is as of April 2024. 23 are at immediate risk of closing. The main drivers behind that, though, honestly, is, as I just referenced, that increase in cost of care. This is pre-pandemic, post-pandemic. Increase the cost of care and the lack of reimbursements or gap in funding has not kept up at that same pace. So it's a true challenge, real challenge.
How many of them are looking at changing their footprint? I mean, you got
I'll mention, absolutely.
one side of the equation says you want to provide all these services,
Yep.
and you only have a certain amount of revenue. How many
Three.
are looking at taking a decrease in that footprint?
Alliant works with 3 hospitals in the state of Alabama. I'll mention this to you. And to your point, all 3 are changing their footprint, if you want to call it, or their, I guess I don't want to say footprint. I want to say their reimbursement methodology to help tighten up that or mitigate that operating loss. 2 of those hospitals are converting to critical access hospital, which is what we are here today. Those, and we anticipate that reimbursement program to help, obviously help improve that rate side of what they're getting paid. That third hospital is moving to an REH model where they are eliminating all inpatient activity, and quite frankly, they have an OB unit, labor and delivery unit. They just don't see it. They just can't. There's no path out. That is the best path out for them to keep services in their community.
They're limited by the doctors they can get.
Within those rural communities, absolutely. Yeah.
Nurses they can get.
It's
They got
struggles.
the same issues we have.
Absolutely. You got very similar, absolutely, very similar issues. I mean, just the discussion last night too alone was,
Forces you to change your.
in a lot of cases, unless there's any type of congressional help to help change that top number or the cash that comes in the organization. Your cash, your revenues, what you collect from those relationships aren't at the same pace that we've had the expenditure increases.
One more question.
Yes, sir.
And the
Yes, sir.
question is, how many of those have the sales tax or outside governmental assistance?
That's a fantastic question. I can tell you that all three do receive some support. You know, I don't want to say that they're not receiving support. They are receiving support, but I would like to see more support. Put it that way. I think I'll leave it at that. But they all three are the three I just referenced. They are receiving a level of support.
And you got to understand also, the purpose of the sales tax is right here in the what the voters voted for, and it says those three items. You know, it's right there, and one of it says paying the cost of operations of healthcare infrastructure and services, and that was the key because if the county did not do that, they would have to pay for it either out of ad valorem or they have to close the hospital.
What was the second?
The second one, paying the cost of operation of healthcare infrastructure and services, including the construction and paying debt services and bonds to construct a new public hospital facility.
Okay, so we got construction, we have to do, you brought it up.
Yeah.
So you got construction, you got operations,
Mhm.
you got fixed assets versus people assets.
Mhm.
Okay?
Good.
All right, now you're sitting there and saying, okay, how do I divvy that pie up?
Mhm.
Right?
Yeah.
Well, the pie's been divvied up already. It's been already divvied up by the county commission.
Legally?
I don't know. I mean,
Legally?
hey, I'm not
Wait,
a
wait,
lawyer.
I'm bringing it up, and I
I'm-
hope you're videoing it.
I'm not-
I want the public to understand we're transparent, right?
Well, I'm not a lawyer. I'm not a contract lawyer. I know we go with what's given to us, and we have this, and the county has divvied up the money, which is very equitable amount. It's fair. I don't know how it should do it. And the county has watched that very closely over the years. And so we have to go with what we're given. We're not in the policy making for the county. We don't make policy for the county. I'm not going to try to do that. You know?
We're
So
not talking about it. We're talking about transparency and
Well-
the openness of how you divvy up the money.
I didn't divvy up the money. The county commission did. And at the time, I guess it was a decision by the county
Yeah,
commission.
there'd have to be a
Are we
county.
guessing or do we know?
I don't know. And I really, that's their business, you know, not mine. I'm here to make sure we're here to make sure the operation of this hospital
I understand that.
is efficient and provides good service with what money we're given. And that's what I'm going to focus on. I can't focus on too much. Well, let's finish with David.
Yeah. Just,
David, I have one more
Yes,
question
sir.
for you.
Yes, sir.
Just with regard to our contracts with insurance companies,
Sure.
That's a continual process, correct?
Absolutely. Always.
And I
Yep.
guess with your network of hospitals, you pretty well know what we should get from the insurance company.
You can see that.
Does
Yeah.
that give you any leverage with them? A little bit? Just knowing helps
Sure.
a lot, right?
Just knowing helps. Absolutely. Yeah, just knowing helps. Right. I mean, you see that.
That's
Yeah.
a lot of money
No,
for
I
us.
mean, the best way to answer it, absolutely. I mean, if you see how one's getting paid, I mean, it helps you with some leverage points on seeing the differences. No, sir. TrueBridge is your billing company, billing and collections. So services are being generated. Yeah, but they're not responsible for the negotiation of contracts and reviewing contracts. Yeah.
Yeah.
Yeah,
Yeah,
we're-
that's what I'm talking about.
Yeah.
That's what I'm talking
Yeah,
about.
that gets back to that team effort. It takes a body of folks to be able to do that. Just a couple other comments just to make. Those key projects, and I know we've talked about those, swing bed program, chronic care program. the mammography services, infusion services, and you can see this on your trends. Those programs continue to perform at you know, paces that we are encouraged to see, particularly the chronic care and the mammography that has helped significantly. Huge lift in swing bed that has helped significantly. That will be ways to where that you will be able to see that increased rate, I guess I should say, that's going to help with some of that gap in profitability the hospital sees. And then lastly, I'll just leave it at this, the financial operating indicators, and we talked about this some, but for the 9 months fiscal year to date period, the hospital has experienced, I said this earlier, but you can see that within the data. Again, transparency to Mr. Berry's point as well. You see all patient care service areas, those are up across the board. Very encouraging to see. Revenues are up across the board. Very encouraging to see. Net patient revenue is up approximately 13% versus where it was this time last year. Again, I'm talking about that 9-month period. So again, encouraging to see. Patient cash collections, I talked about this earlier, is well up year over year, and as is your net income, referenced by that $429,000 bottom line performance now. So a lot of positive activity here is happening at Weems throughout this 9-month fiscal year period. Any other questions?
Is there a possibility in that section called key project status indicators, is there a possibility that we can get some type of ranking as to their contribution to the overall program from month to month so we can see how it vacillates?
Yeah, I think that's an excellent point. You can see it obviously in the count, but seeing how it translates into profitability. Right. See how it translates into profitability. Right. Is it a service we want to continue providing? Yeah, absolutely.
The only statement I want to make is that we've talked a lot about the profitability and operating profit. I recognize that that's going to be a tough nut to get to, an operating profit here that's a break even with the services that we provide. But I think the community does owe the hospital a certain amount of support in financial support, because we are taking on the health and well-being of the community. So there is a responsibility on the community side to kick into the bucket here. And I'm just happy that in our organization, or our town here in our county, we're able to bring in tourism and get those extra ad valorem dollars that the outside public that's visiting us is providing. In some of your other rural hospitals that may not be a vacation spot or an attractive vacation spot, they're not able to bring in those extra dollars that we are. So we're in a pretty good position in supporting the other than operating income number at the bottom line, which is supporting us, which is floating everything.
Excellent point. I mean, you're 100% correct.
But your profitability goes back to your footprint. That's if you're looking at the overall big picture, you can't sustain something constantly because you're going to get an uproar before it's all said and done. Why aren't you in a profitable position? So you've got to look at how you're going to shrink that footprint or enlarge it with more services or something like that to get to that break even.
I think you want operating profit as close to zero as you possibly can, but I think it's going to be an impossibility. I'm just saying we're lucky that we have the community support to provide the gap between the two.
Chairman, that's all I have, unless there's any other comments,
Anything else,
questions.
anybody?
Thank you.
Yes,
Thank
sir.
you very
Yeah,
much.
Thank you. Good questions.
Very informative.
Yep.
Okay, are you going to say a couple things?
You want to take a break right now and then come back?
You want to do executive session?
Or, yeah.
Mr. Bowling's going to do a lineup thing.
I'll give a brief line update. Folks are probably ready for me to move on the agenda, but yeah, just real quick on the line update, just to help or give where we're at. One of the open positions that we've had within the organization has been a clinical position. We've been looking for and recruiting a vice president for clinical services. We are at that stage to where I don't think the offer will go out tomorrow. It may, if I can get back around quick enough to get the offer out the door. But we are at the point of submitting an offer to an individual. If it doesn't go out tomorrow, it'll go out next week, obviously. We're excited to have this individual come on board when she's able to come on board and accept and hopefully does accept. We get started. We'll certainly have her come by as well. Courtney, she'll work closely with Courtney and the team, and we'll have her come on site here as well and be introduced and so forth. That way the board can meet this individual as well. Other than that, I know I spoke a lot about a lot of other things that doing focused here at Weems, but
So I guess, David, we're waiting on bated breath to hear what the Board of County Commissioners and the consultants have to say about
Yeah.
the management of this hospital
Sure.
moving forward.
Yeah,
And
yeah,
your renewal of your contract comes up
Yeah.
in October, correct?
yes,
So-
yes, yeah. So yeah, we certainly, are anxious to as well, and we obviously truly love what we're doing and continue to work, hope to continue to work, and hope to continue to do what we can do to help.
One thing that somebody mentioned, I think it was John, with regard to the funding we get from the county, the folks that all of us pay that penny sales tax, and they are going to want to know what we're doing with it, okay? And you can either better yourself with it,
Mm-hmm.
you can maintain with it, or you can slide the other way. Financially, I think we're about as okay as we're going to be. We can always seek to improve. Could we look, what I'm asking, in the last, I would think a 3-year, 4-year timeline, what have we added to the hospital? What programs have we added? Okay, we got mammography. Now we got support for that, but if it wasn't, the hospital wasn't here, we wouldn't have mammography now. We've, I know the infusion, that's something new, and I don't know what all it is, inpatient, we've really increased that a lot. I don't remember if we had inpatient, not inpatient,
Swing bed.
the swing beds, but we've greatly improved that. I'm just talking off the top of my head. The hospice that we're doing, any capital, we're fixing to we've added a lot of good machinery, equipment, and stuff like that. I think we need to take a little reflective look. So we'll have something, and I think we've added a lot of programs here.
Yeah.
So I do think that the time is here to look back a little bit and see what we've done, and that'll give us, where have you spent the money?
Yeah.
Well, one thing we spent the money, salary, to me is improvement. If we have increased the pay to our staff, so we're competitive.
That's great.
That's
That's
a big
great.
issue right there. That's where we spend a lot of money.
That's great.
And it was necessary money.
Yeah.
So I would like to look back. I mean, it's just a financial type thing. I would like to make a little look back, maybe 5 years. I'm not sure, David. I don't know if you can look back 5 years, but I think some point right there, maybe from there to here, and I don't know how you dig all that up. Just have to do that. Yes, ma'am. If we hadn't done enough, need to do more.
I have lived in Apalachicola since 1985. I remember when this place was so filthy and so understaffed, and just, it was scary even to think about coming in this building. And I think we should give ourselves some credit, all of us, all through these years, that the way it is now is wonderful and constantly improving. And we need to emphasize that. Okay?
I know. I'm not. Yeah, we need to look at it and see. I think now's the time to look at it and see. And
we can go back, if you look at
sales tax money, that's what we're talking about. You know, you get this year we're projecting to get 1.7 billion in sales tax, probably plus 120,000. That money specifically goes towards salaries. I mean, our salaries here, just for the hospital and the clinics, 3.5 million and 860,000 plus that for benefits. And then you look at the EMS part, you know what I mean, that the hospital is supplementing the EMS. You know, so really, the sales tax dollars can go towards salaries, you know, and that still won't cover all the salaries that you can after the year. Then you look at of course, your under and uninsured payments, stuff that we write off, you know, we can calculate that part. Then we also can go back and look at the different improvements that we've done throughout the years of the hospital and the new programs. You know, we can come up with that kind of list, but just be mindful that 1.7, you know, going towards salary. I mean, that just we increase the salary. That's just still not enough.
Well, it's getting us competitive. It's a process right there. And you get better health care when you don't have turnover of your staff.
Absolutely correct. Absolutely.
I mean, we have Courtney, what's your title? Chief of nursing, what's your, you know, how long have you been in that position now? That's great.
Yeah.
That's great.
Well, she's been here.
I mean, that's absolutely great.
Well,
you know?
she's been in that position 5.5 years, because I've been here 8 years now. August will be 8.
Have you been here that long?
Yeah, I'm the longest serving CEO at Weems.
Well, what I'm saying is retaining quality staff. We've been able to retain quality staff. You know?
Yeah.
We've added quality staff with that. So I think stuff like that gets overlooked. And our clinics have increased. People going to them. That's been a slow process, but people are getting confident in the care they get from the clinic. That's word of mouth stuff. You know, you don't do that overnight, and it's a slow process. But I do think if we look back and we could reflect to where we're at, we could show, who was it brought that up? Oh, that's you? About the money spent, how are we spending the money? I think that's a good way to see what do we do with the money right there. We went through when was the hurricane? When was Michael? How long ago?
October 28th.
Well, that's along that same timeline, and we had emergency rooms totally destroyed. Okay, we set up an emergency room over at the clinic there in 2 weeks, and we had a emergency room going. We spent a lot of money on that, and I know it might have been some grant money. I'm not sure, insurance money, but our staff got extended by it. You know, we went through the COVID, and I think the whole country still recovered from COVID. You know? So I mean, there's a lot of things that in the last, if you just look at last year, like, you don't get a full picture of it. It's like building a football team. You don't do it in 1 year. You know, you don't draft 2 people and change it. You know? So I would like to see that and see how we've come along, and maybe looking at that, what else we can do too.
Right.
Okay?
Well,
Unfortunately, even don't look at it completely like business people look at it from the standpoint of what are you doing for me today?
Well,
You know,
I'm going to show them
they
what we're
don't
doing.
care what you did in the past. They want to know, what are you doing for me today to try to get that deficit down?
Well, we'll show them what we're doing today versus. That's the only way you can do. You know, versus 3 years ago.
Absolutely.
You know,
Well, I think
4 years ago, 5 years ago.
Yeah.
And
that's a good
I
point.
understand
People
what
have
you're talking
short
about.
memories. They forget what how the journey's been. But you're I think, Mr. Chairman, you're exactly right, and we can pull that together. I know we're getting ready to start the budget process for 9/30 for the fiscal year and for the facility. Looking at some information. Absolutely. Absolutely.
And it'll help us
Yep.
too. You
I
know,
agree.
we'll see what we've
Y'all
done.
were
Well-
gonna pull together a pro forma for an REH
Yeah.
format,
Yeah.
okay?
Yeah.
I haven't seen
They
it.
did that. I think they
Yeah.
Presented.
They presented
Yeah,
that
they
to the
presented
board.
We
that.
did present that. Yeah.
They presented to the board. Maybe we can get them that
Yeah, I
performance
can-
that you all did.
Yeah, I can get you. I
Here's an
can sit down
REH.
with you on that.
Under
Yeah.
an REH, this is what we're
Yeah.
gonna do, or we can do.
Yeah.
Now, what's the deltas in there? That's a
Yeah.
pro forma, meaning looking forward.
Yeah. Sure. Sure.
not the past, looking forward, with this type of funding, how is it gonna help
Right.
us?
It's where do we want to be? I
Well,
agree.
we got it. We have it.
I don't remember seeing it.
Oh, yeah.
I think-
It was a presentation at the board
Yeah,
meeting,
it
I
was
believe.
shared. It was
Why
shared
don't,
as a.
why don't we make sure we get that? there?
When,
I can get
Barry?
you. I can get you a copy of what was presented.
Well,
Absolutely.
Evidently I have it. What's the name of it?
The
What's
name.
of the document?
I'll find the.
Should be in your book, right?
I'll get you. Yeah, I can, Mr. Barry, I can get you a copy of that. I mean, I know that was presented. That was actually presented at the county commissioners meeting as well.
yeah,
Yeah.
Mr. Barry, it was
Yeah.
presented here
Yeah.
by Alliant, and then
Yeah.
they presented it to the Board of County Commissioners as
Yeah.
a presentation on how they thought we were
Yeah.
going to move forward with the management of the hospital. And I think your comment at the time was, aren't you putting the cart before the horse? Because we said, you know, we shouldn't be giving out all the secrets of how Alliant's going to move forward if we got competitors coming in and also trying to become the management company for the hospital.
Well, I
You
did
remember
say
that now?
I did say that, but I did not realize that they were presenting a pro forma or pro forma format of what the hospital would look like.
That was one of the slides in there, in their proposal.
I'll go back and look at it.
Yeah. Yeah, absolutely. I can get you a copy
David,
of
what
it.
y'all think about that? Board, what do you think about doing a look back and a look forward? I mean, but we're talking about what have we done?
I like it.
What have we done?
I like it.
You know,
I mean, I think it's fantastic to do. I think you
I
need to
like-
do
I
that.
sure
I
would
think you
like
need to
to
look at
see
the capital dollars that's been put into the hospital,
Yeah, capital
the
dollars, we put a
increase,
lot
the
in here. You
increase,
don't
the
just-
increase
it
in the
don't just go.
workforce.
It don't-
Yeah,
I know we bought a lot of equipment for,
Radiology.
radiology. I mean,
Lab,
there's a-
yeah.
Okay, let me get off that.
oh, you're good. I think it's good. I think you look in and I want to just publicly say this as well. I mean, you look at the operating indicators. You look at 21, 22, 23, 24. I mean, and I'm going to say this respectively for those years, but 2021 you had 1,100. I'm rounding 1,100 outpatient visits. 22, roughly 1,100 outpatient visits. 23, 1,700 outpatient visits. So far, 24 as well on that same trajectory. 2,700 outpatient visits.
There's
volume
something we're doing right.
ER falls in that same suit, 24, 26, 28, 3,900 ER. So again, volume is moving in a better direction. There's something to say about that, right? There's a reason behind
No,
that.
we
You got clean facilities, you got stronger workforce that's getting paid more competitively, so you can maintain that workforce. All that goes together to help run your hospital. So,
give ourselves some credit.
yeah,
Well, I
absolutely.
don't think we need no credit. We need to see, that it's an instrument to see, to show some folks, you know, and it's, you know, good or bad, what we've done. And if we've had failures along the way, but, you know, some missteps, it's gonna happen, you know. Don't tell me what you ain't done, tell me what you done. That's all I wanna know. Tell me what you done. Thank you, Dave.
And what you're planning.
Yeah, best we can.
All right, well, that was,
Along that line, has anybody seen the scope of services that Baker Tilly's supposed to do for us?
I hadn't seen that yet.
Okay. What you planning?
I don't know, that's the county.
Yeah, so we hadn't heard from Baker Tilly and what the county want to do for that. So my report, the governing board bylaws, you know, thank God they've been signed, so you all should have a copy of that. Thank you all for all the work that you have done. Thank you, John, for
No, you think you already.
bulldogging this, but thank you all. These bylaws here, they were approved by the county commission. You all should have a copy of that. I went through all these other items. One of the last things, the audit risk assessment update. Next month, we will have a closed door session on the IT update and audit risk assessment. David Bolin and I with Eagle Tree Management with Brian Hall, we met with the auditor. And so, you know, we'll discuss that behind closed doors with Brian's recommendation.
What is it, the service that we use? Eagle Tree,
Yeah.
are they involved?
Yeah, they were involved in that conversation with the auditor, with David Bowling and myself. And so Brian kind of gave us an idea, you know, here's the audit findings, here's what we're looking for. And I want to discuss that behind closed doors with the board, you know.
What I'd like to do with that
Not
is
in
just
public.
have
Yeah.
no discussion at all about IT, except during executive services. So, you know, I just don't think it's a good idea when you're talking about the security of the component of your place there. I know I never did. Everything's behind closed doors. And, I think we're well within the bounds of what's necessary. You know, we can do that. You know, that is a secret.
Yeah,
It needs
yeah.
to be a secret.
Yeah, and Brian Hall did give us some direction.
But
on-
the contract is not a secret.
Oh, no.
The contract hadn't been amended since
Yeah.
2013?
Yeah, 2013.
Yeah.
You know, the contract's not a secret, but anything we're gonna do, but we're gonna have an executive session, the next meeting concerning,
Yes.
security of our.
Yes, and Brian Hall gave us some direction about, you know, third party and all that kind of stuff, so that's gonna be good. All right, and that's all I have. David Bowling and I will be this afternoon, the county budget workshops. The county started this morning. Long list of agencies, they'll be doing that tomorrow, this afternoon. There's a county budget that they put together, information on there that we'll present to the county this afternoon. And then right after that, I know Bill is getting ready to do a update foundation, but I want to just, you know, Colleen Zester, and I'm not going to give Bill a lot of credit because I don't know what he's doing, but I just know Colleen has been doing a lot of work, and we just want to thank Colleen.
I'm just a worker. She's the boss.
Okay, all right. That's all I have, Deputy.
All right, thank you. Bill?
All right,
Go for it.
so
Foundation. update.
foundation update, we're doing a lot for the gala that's coming up in November. We did have a question about, is there some kind of an employee discount that's going to be provided by the foundation so that employees could attend the event? We thought about it. You know, there's a thin line between giving discounts to the employees when, on the other hand, we want to give a large check to the hospital. So we wanted to try and, you know, be fair about it, but also collect money for the hospital at the end of the day. What we did decide to do was we're going to give an extra discount. There's an early bird discount for the general public of $750 for a full table. Full table would typically be $800, but if you get it in before September 1st, it's $750. That's for the general public. We'll do for the employees, if they come up with a whole table of 8, $700. If they get it in before September 1st. So those are our discounted table offerings. We're not going to do it on an individual ticket basis.
That's less than $100. That's for 8 people.
Yeah.
Somewhere.
Yeah. So that's what we're going to do.
Eight nowadays.
Well, we've already got 2 Sapphire level, I guess, donors. That's $2,500. So we've got 2 of those already in, and one Emerald donor, which is $1,000. So we're moving along with ticket sales. We'd like to get some more tables and individuals on. It'd be great if you know, the people from the board want to bring their families or friends and set up a table. It has to the tables have to go through one. You can't have you know, 8 people just sending in their $100 donation. It has to be on one card or one donation. So collect the money from your friends and put together a table. We're also doing something that we didn't talk yet to David about, but the idea came up that we would like to do a Franklin County Family Heirloom Cookbook as part of the event. Theme being deeply rooted Apalachicola heritage recipes not to be forgotten. So we're thinking that we'd like to get some people, maybe friends of the board, or maybe through the church. You could put it out there with your church. We'll put it out through Trinity Church as well. Gather some recipes from locals, and we'll put together a little booklet that could also be, you know, distributed out at the event, which I think is a nice little extra for people.
People
Would be a
love
fun
that.
thing to
People
have,
love that.
and it's all from your neighbors. You know, people right here in Apalachicola and surrounding Franklin County. So we're working on that right now. If we get some participation on that, we can get print and ready for the event, go online or have printed copies. So I think that'd be fun. Social media is out already. We put the sign up in the downtown right by the Exxon. So if you've seen that, that's up there, banner and signage. Social media, it's live online everywhere that we can think of. And we just yesterday had Pastor Stephen Picot. He did a reading of a commercial for Oyster Radio. So you're going to be hearing on Oyster Radio, August and September, there's going to be spots during the day advertising the gala. And there's 4 daily spots and 1 overnight spot, trying to boost the early bird ticket sales. So we've got that going too. So we're trying to get it out there as quickly as possible and trying to get early money in if we can. July 3rd waterfront celebration went great. We did a fundraiser with lemonade and a pair of tickets being raffled off to the winner, Bonnie Durham. We got a nice picture with David and Bonnie and Colleen. From 3 to 7, we sold out the lemonade and all of the commemorative cups that we had that I showed you that changed color and all. I don't know how many are out there, but we had 250 and we sold them all out. So they're circulating in the community now. Some of them may be retained, hopefully, not all in the garbage. And I think we raised close to $600 or $700 that day between the contribution from the lemonade stand and the raffle tickets that we sold for the thing. So anyway, that's where we are on the update on the anniversary gala. And if you would, anybody that has not already gone on Facebook and liked or connected to the foundation should do so. You can search it on Facebook. It will come up Weems Memorial Hospital Foundation, and then just connect to it. Follow it.
I think I'm getting stuff all the time.
That's just Colleen sending you all kinds of stuff.
No, that's not. That's just stuff.
What is it? What do you search for?
On Facebook. Weems Memorial Hospital. No, Weems Memorial Hospital Foundation.
Okay, have we got any other business? Okay, this meeting is adjourned and we'll go into executive session for the quality report, which is required if we're in executive session. We'll just stay here, we just had a break.